Hi, I'm Deb from Global Travel and Medical. I'm a registered nurse with over 30 years experience in intensive care and A&E, and I just wanted to come on and talk about all things political within the NHS and the healthcare sector globally. Okay, so the case that's in the papers at the moment is about the Lucy Letby case, an intensive care environment which is really, really stressful. Young babies born prematurely who are very unstable, just like most patients in intensive care, living on a knife edge, and uh, things happening that you have to respond to very, very quickly to prevent a further deterioration. It's a very pressurised environment and it requires specialist skills and a very steady nerve in order to cope with working day in, day out in that kind of environment. Now, one of the things that I noticed from reading about Lucy's case is it appears that she wasn't supported in a way that she should have been. I think there was nobody giving a helicopter view to what was happening in that unit, from the culture down to the management, the business management and the clinical management, the stress that the nurses are placed under, particularly her, and the interface of working with the medical staff. Back when I trained, the medical staff and the nursing staff were very much overlapped, a bit like a Venn diagram really, overlapped in their roles in terms of patient care and trusted one another. Now, since the NHS has changed, and I'm saying that gently, since the mid-90s, definitely, we now have this third element that's come in, business managers. And here we are. The problem with having business managers who don't just stick to business but involve themselves in clinical matters and try and turn a service into a business is that it disrupts how that hospital, how that department works. So you've got this third element who are very corporate and don't fully appreciate how difficult it is to work in an intensive care unit, who are making decisions and trying to collate information that really they don't have that much knowledge about. One of the other things I'm thinking here is, where was Lucy's professional body, i.e. the Royal College of Nursing or Unison or some other professional organisation that was supposed to be looking after her if she had one. There's not a lot said about her legal team. I wonder if the legal team are from the Royal College of Nursing. Maybe they are, maybe they're not, who knows. But the support for her in terms of her professional role appears to be sadly lacking. There doesn't seem to be, from all the mainstream media I've looked at and I've read in terms of newspapers, anybody appreciating what kind of area she was working in, what kind of situation she was working under, the shifts, the camaraderie within the unit, the working relationship and professional relationship with the doctors, the long hours without breaks often, things like annual leave. Did she take time out from her role to recalibrate? Did she have the support of her clinical managers throughout all of this? And if so, what kind of support was it? And since she's been in prison, who's been to visit her or who keeps in touch with her? It's great that, the legal team have taken on a panel of experts to review the patient notes. And as distressing as it is for the family, the truth has to be known. If they're saying that Lucy is innocent and these babies have died of natural causes through the natural progression of, multi-organ failure, sepsis, etc., because of their prematurity, especially, then this is now very serious, because if this is happening to one nurse in one hospital, what else is happening to other nurses in other hospitals that are not as well publicised. And it doesn't have to be a high profile case where patients are dying. I'm talking about patients who aren't being cared for properly as well. Who's standing up for the situation those nurses are working in? Who's looking at the environment that they're working in? Who is appreciating that this change that business managers brought in the 90s of 12-hour shifts and splitting shifts so that you finish nights at 7:30, 8 o'clock in the morning and have to come back on duty later that day. All of these things, which I'm only just touching the surface of, none of these things are being considered at all in any kind of environment. And I think what I'm saying in a roundabout way is that healthcare personnel at all levels, but particularly nurses and doctors, they're not getting the breaks because they're now unpaid. There used to be an hour of paid break. They're now unpaid, half an hour per 6 hours. The hydration, very difficult to grab a drink because there's not enough staff. You can't get away to take breaks, particularly in intensive care and A&E. And the psychological support for dealing with such sick and critically ill people and their families, that's a lot to take in on a 12-hour shift, day in, day out. Okay, I don't want to make this video very long. This is starting on a series of videos because as a seasoned registered nurse, I just don't want to sit back reading and responding to other people's views on this. I want to bring something out and work towards making videos for people who may not understand how the NHS works. And I think slowly, I want to bring that to the public's attention. I think also as well, there are a lot of things within healthcare that we suffer from that also need addressing, that I'd like to put out there in order to help people to cope and live every day. But that's for another video. But for now, I think I'll be watching the rest of this rollout. And I just hope that justice is served in terms of, if this new evidence means that Lucy is freed, then let's get it done and get this girl's life back on track, because the NHS has lost another good nurse and they're losing nurses hand over fist because of the culture within hospitals that never used to be there, especially when I started training. It's changed. I'm so privileged that I worked in the NHS when it was a service instead of it now just being a business. And working towards privatisation with these contracts and partnerships with the private sector. I appreciate things have to change, but there are ways of changing it, and not supporting your staff, not paying them properly, not appreciating the stress that they're under is not the way to do it. And then when it gets as serious as to accuse a nurse of harming babies, when in fact those babies were ill anyway and the outcome wouldn't have been good, is disgusting. I mean, there's no other word for it. It's just really bad. Anyway, I think I've said my piece. I just hope everybody's okay. And as these videos grow, I hope we can provide a community whereby we can discuss these things and talk about the NHS, because it's something very close to my heart. I can't do much about it in terms of its transitioning to making contracts with the private sector. I still believe it should be a service and a public service, but I'm only one person. But anyway, I'll come back to that another time. So thank you for listening.